COVID-19 has forced several businesses to put up the closed for business sign, but that's not an option for healthcare workers, including those responsible for getting sick people to the hospital by helicopter.
KCAU-9 News reporter Lydia Vasquez taking us behind the scenes of the Mercy One AirMed flight crew and explains what the last several months have really been like in our top story at 6.
We always make sure we do one quick walk around if you'll follow me.
It's a mobile ICU. That's how the Mercy One AirMed flight crew humbly describes what they provide 24/7, 365. With and without COVID-19, these crews are transferring patients from rural communities to Sioux City and even Omaha.
We're just trying to be a bridge to support them till they can get there.
Nick Gonzalez manages the clinical crew for Mercy One AirMed. He says this year has been eye-opening, even for an experienced emergency responder.
I mean, it's tough. I mean, the patients that we've had have been some of the sickest I've ever seen.
Gonzalez says just like the medical staff inside the hospital walls, virus concerns are challenging for those inside Mercy One AirMed.
It's exhausting, but I mean, we still come in, we try to do the same job and just keep up with the pace and just watching out for each other and making sure we're not getting worn down.
We got external power switch not connected.
Nick Venetia is the Mercy One AirMed pilot. He says normally the crew would transfer patients back to a hospital, but with the volume of COVID cases, it has become a challenge figuring out which hospitals have room to admit a patient.
We might find a patient that's out, say, in, out in Norfolk, and then have to move that patient all the way to Des Moines because the beds are full here at Sioux City. We got 22 volts, we're ready for engine start.
Pilot Venetia says despite challenges COVID-19 has brought on, it's still a privilege to take off on each call. In Sioux City, Lydia Vasquez, KCAU 9 News.